Hello, I'm Dr. Mark Wyers, Director of Endovascular Therapy at Beth Israel Deaconess Medical Center. I'm one of the vascular surgeons at the CardioVascular Institute, and thanks for taking a little time to learn about our unique endovascular suite. We are one of the very few centers in the world that offer the benefits of real-time three-dimensional imaging to our vascular patients, so that complex surgery can be done more quickly and more safely. Let's go upstairs and take a closer look.
Hi, I'm Laura Pelletier, one of the mid-level practitioners on the vascular surgery service. Behind these doors, some very advanced procedures take place every day. This room functions as both an endovascular suite, which allows for a non-surgical, minimally invasive approach to vascular disease, as well as an operating room for traditional open surgery. These procedures are all performed by an experienced team of physicians who are pushing the boundaries of modern vascular surgery every day. Dr. Wyers is inside, and he can explain the room in more detail.
Welcome to the endovascular suite. Endovascular surgeons these days do about half of their procedures using this minimally invasive technique. Essentially what endovascular means is we put a small tube in through the artery in the groin.
Can we get a venous line?
And use that tube to work through to either open up a blockage, to insert a graft, to treat an aneurysm, to fix a carotid blockage. All of those are procedures that we do here in the suite using specialized imaging. These procedures run the gamut. It can be a minor procedure that you go home right after the procedure. It can be a much larger procedure that requires a couple of days in the hospital, but because it's less invasive, still allows you to go home much sooner than with open surgery. These procedures can be done through very small sheaths like this one, or through a large sheath like this one. Regardless of the sheath size, we have to see where we're going. A lot of these procedures require a lot of preoperative planning, so often we use CAT scan information to generate a three-dimensional model. While we're able to plan these procedures in 3 dimensions, the actual working image is often just 2 dimensions, a very flat-looking image. So what this technology allows us to do then is to synthesize those 2 techniques so that the working image becomes a real 3-dimensional, real-time image. And you can see that these pictures are manipulatable so that we can adjust with whatever view we need to navigate our way through the vessels and accomplish our goal. With the newest generation of endovascular grafts, it's actually very important to have this 3-dimensional imaging because these newest grafts allow us to treat a whole different range of aneurysms which go up as high as the kidney arteries and even higher. We're very lucky here to have a 3-dimensional imaging system that allows us to see where we're going and navigate our way through blood vessels to deploy these grafts very accurately. This has a lot of real benefits, both for the patient and for the team, because what this does is allow us to move along a little bit faster and with more confidence that we are in the correct position. That minimizes the amount of contrast dye that we have to give to patients. It minimizes the amount of radiation that the patient is exposed to and that the team is exposed to. So as you can see, the endovascular suite, operating room 18, is one more example of the commitment we all share at Beth Israel Deaconess Medical Center to deliver the best care we can to you and your loved ones.